The article point-of-care rapid immunoassay performed on voided urine, refrigerated up to 24 hours, accurately detects bacteriuria, authored by Grant et al., investigates the effectiveness of a rapid immunoassay in detecting bacteriuria in dogs suspected of having urinary tract infections UTIs. This study is significant because the International Society for Companion Animal Infectious Diseases recommends aerobic urine culture from cystocentesis as the gold standard for UTI diagnosis in dogs. While this method is reliable, waiting for urine culture results can delay treatment if a patient is infected, as well as delay further diagnostics and treatment if a patient is not infected. The study aims to evaluate the performance of a commercially available rapid immunoassay, Rapid BACVET, on voided urine samples, considering its convenience and cost-effectiveness compared to traditional urine culture. The researchers designed a prospective study at the Virginia Maryland College of Veterinary Medicine. 40 client-owned dogs showing at least one clinical sign of lower urinary tract disease were enrolled. Clinical signs included polycynuria, parayuria, incontinence, gross hematuria, stranguria, and excessive licking of genitalia. Voided urine samples were collected and transferred to sterile tubes. The rapid immunoassay was performed in triplicate within 30 minutes of collection, and again after 4 and 24 hours of refrigeration at 4 degrees Celsius. Cystocentesis was performed within 4 hours of voided urine collection for urinalysis and aerobic bacterial culture. The technicians performing the rapid immunoassay and the medical technologists conducting urinalysis and cultures were blinded to each other's results. Bacterial growth on the culture plate was considered positive for both bacteriuria and UTI diagnosis, given the dog's clinical signs. Discrepancies in triplicate rapid immunoassay results were resolved by considering the majority result as the diagnosis. 5 out of 120 rapid immunoassay examination time points were not performed due to staff unavailability, and these data points were excluded from analysis. Table 1 displays the individual rapid immunoassay results at each time point and the corresponding urine culture results for all 40 dogs. The table details the bacterial species identified in positive urine cultures and their colony-forming unit counts. Statistical analysis involved calculating sensitivity, specificity, positive and negative predictive values for the rapid immunoassay at each time point, using urine culture as the reference standard. A chi-squared test was used to assess the association between rapid immunoassay and culture results. A simple kappa statistic measured the agreement between them as well as the agreement within rapid immunoassay triplicates. Potential associations between discordant rapid immunoassay and culture results and baseline variables like age, sex, and clinical signs were analyzed using statistical tests. 14 out of the 40 dogs, 35%, had confirmed UTIs based on aerobic urine culture, and all of them displayed positive rapid immunoassay results. Only 3 dogs had false positive rapid immunoassay results. The rapid immunoassay demonstrated 100% sensitivity, 88% specificity, 82% positive predictive value, and 100% negative predictive value. Importantly, these values remained consistent after 4 and 24 hours of refrigeration. Table 2 summarizes the diagnostic performance of the rapid immunoassay at different time points. The table provides the sensitivity, specificity, positive predictive value, and negative predictive value along with their 95% confidence intervals. The discussion highlights the study's key findings. The rapid immunoassay performed exceptionally well in detecting bacteriuria in dogs with lower urinary tract signs, aligning with the gold standard of cystocentesis urine culture. The high sensitivity suggests that a negative rapid immunoassay result can rule out UTI with confidence, allowing for quicker exploration of alternative diagnoses and avoiding unnecessary antibiotic prescriptions. While a positive rapid immunoassay result is highly suggestive of UTI, a confirmatory urine culture is still recommended for definitive diagnosis, antibiotic susceptibility testing, and confirmation or exclusion of UTI. The authors emphasize that this screening test's practicality and efficiency are enhanced by its ability to be performed during an outpatient visit. The study's results are compared to previous studies evaluating the diagnostic accuracy of urinalysis for bacteriuria. While urinalysis performed by experienced medical technologists has demonstrated comparable or even superior sensitivity and specificity to the rapid immunoassay, the authors argue that the rapid immunoassay's simplicity and lack of requirement for specialized expertise make it a more practical option for routine veterinary practice. Furthermore, the rapid immunoassay outperforms automated urine analyzers in terms of specificity, minimizing the risk of unnecessary urine culture recommendations. The study also emphasizes the rapid immunoassay's high precision, with only 2 discrepancies observed within triplicates out of 120 tests. These discrepancies were not associated with any patient characteristics or clinical signs, suggesting that the test is robust and reliable. The finding that refrigeration for up to 24 hours did not affect the rapid immunoassay's performance supports the feasibility of at-home urine collection by owners, offering convenience and potentially reducing stress for the animals. The authors acknowledge the limitations of the study, including the small sample size, 40 dogs, and the occasional missing rapid immunoassay observations due to staff unavailability. However, they argue that the study's findings are consistent with previous research on the rapid immunoassay, suggesting that the results are likely generalizable to the wider dog population. The study did not evaluate the rapid immunoassay's sensitivity for detecting low bacterial colony counts, which remains an area for further investigation. The authors conclude that the point-of-care rapid immunoassay is a valuable tool for screening dogs with lower urinary tract signs for UTI. Its rapid turnaround time, Low cost and ease of use make it a practical alternative to urine culture, particularly in outpatient settings. The high negative predictive value allows for confident exclusion of UTI in dogs with negative results, enabling prompt and targeted diagnostic and therapeutic interventions. While a positive rapid immunoassay result should ideally be confirmed with urine culture for definitive diagnosis and antibiotic susceptibility testing, the test provides a valuable initial assessment that can guide clinical decision-making and improve patient care. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.